Now, the World Health Organization launched a new guidelines this week on the use of medically important antimicrobials in food-producing animals. Take a listen.
Medical experts say overuse and misuse of antibiotics in animals and humans is contributing to the rising threat of antibiotic resistance. The director of the Department of Food Safety with the World Health Organization explains.
The resistance bacteria that emerge in animals can jump to humans through food, through direct contact with animals, and through environment.
Miyagishima says in some countries, approximately 80% of the total consumption of medically important antibiotics is in the animal sector, largely for growth promotion in healthy animals. And the majority of these antibiotics are the same as or belong to the same classes of antibiotic used in humans. Some types of bacteria that cause serious infections in humans have already developed resistance to most or all of the available treatments. And there are very few promising options in the research pipeline, to which the WHO recommends the following.
First, stop using antimicrobial as growth promotion. Stop unnecessary use, for example, for prevention, certain types of prevention, and also use antimicrobials only for treatment and control of established infections in animals.
The new WHO recommendations are comprehensive and aim to help preserve the effectiveness of antibiotics that are important for human medicine by reducing their unnecessary use in animals, and there is some good news.
The good news is that these guidelines have been implemented now in many countries in Europe, for example, and we are seeing significant impact on the reduction of resistant bacteria in the human population.
Since 2006, the European Union has banned the use of antibiotics for growth promotion. Consumers are also driving the demand for meat raised without routine use of antibiotics, with some major food chains adopting antibiotic-free policies for their meat supplies. Alternative options to using antibiotics for disease prevention in animals include improving hygiene, better use of vaccination, and changes in animal housing and husbandry practices.